One of our earliest experiences in laser eye surgery that I will always treasure is our opportunity to start a brand new clinic in the center of London, which would end up becoming the London Vision Clinic. And during that experience, we had really an open opportunity to do what it took to provide 5-star Ritz-Carlton service and bring that to a clinical environment. And we were, to be honest, quite fortunate that we were able to have people in place and hire some really, really great people who could deliver on that service and that standard. Now, one of the things that I found in retrospect that enabled us to do just that, and I can't take credit entirely for myself, certainly, or even Laura, but rather the credit is due to those people who delivered that service. But one thing that we did do right is we empowered those people to make their own decisions, to make their own calls. And we allowed them to use their judgment to treat people just as they themselves would like to be treated, or as if they were to treat a family member. And I think that is the number one thing that people have to understand about service. It's not so much about routine protocols, although that matters. It's not so much about standards, although you need those in order to know whether you're doing it right. It's not so much about scripts and plans. However, those are really handy when trying to recover things, especially when you're on your feet. But what most matters is hiring those folks and giving them the power to be able to exercise their good judgment. And when you do that, when you back up your staff, and not only that, but also treat them more importantly than you would treat your own clients, customers, or patients, then they're going to be able to feel like it's worth it to them personally to treat all of your patients just as good as they're treated. And I think that if you think about that, that's going to get you down the right track when it comes to customer service. And then you can layer in all the training and all the standards and all the protocols and all the routines and all the plans and all the procedures. Those are all vital, but start with that foundation in place. Be a good person, be a good boss, be a good leader. And then you can expect your people to be fantastic to those people you value just as much like your customers.
How do you get ready to wow in a clinic? It's similar to remarkable, able to remark upon, but it's even more than that. Like if you have a wow response, something has happened to you during that service experience. If you think about taking a flight or going to a hotel or going to a spa or doing something where you kind of expect a higher level of service, to be wowed nowadays is rare. So if you think about making wow a target for you and your clinic, this is a competitive tool that you can use to help you stand apart. And the aim of everything that we're trying to do is to help you stand apart from the evoked set of 2 to 3 other clinics that a patient is considering when they're coming in. They're sort of looking around and they're saying, you know, are these the guys? Are these the guys that are gonna best help me transform my life? So getting ready to wow is really putting on your thinking cap and saying, how can we do something that's not a box check? It's not, you know, yes, of course you gave them coffee, and of course you have a fresh lick of paint on the wall, and of course you have, you know, tick, 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 all the normal things. This is going above and beyond that. A great book on this subject, and a very, very early forerunner of customer experience, is a book called Raving Fans by Kenneth Blanchard. And it's the same idea. Wow, raving fans. It sounds like raving lunatic, doesn't it? So raving, you know, you're literally like, you just cannot help from telling people about the experience. So you've got to think, in order to do that, I really do need to put some processes and systems in place so that I have planned out exactly what's going to happen, and so that I make an emotional connection with the customer. What is that first experience like from the moment they call you? What are you going to do on the telephone to make them feel like, wow, this is a different experience than the guy I called and just, you know, said it was, you know, 4,000 and then hung up? Oh, this is very, very different. Wow, they asked me questions, they engaged me, they actually asked me about my life. What can I do when they first come in? Yes, of course, give them coffee, but you know, in some of the clinics we work with, they have a menu. In some of the clinics they work with, they have a magazine subscription to every single magazine that you could possibly, you know, imagine, and of course, including visually, you know, relevant magazines with travel and lifestyle and that kind of thing, so that it makes you experience the after before you've even had your consultation. You're seeing all of these wonderful magazine covers and everything that can happen. Some clinics have, in waiting room videos. If you feel like your waiting room experience is going to be a long time, you can offer some activities so that you can lessen the wait. Obviously, exceptional Wi-Fi. But going beyond that, there's things that you can do at every different stage of the procedure. Even during surgery, on the surgery day, you can have, some clinics do little massages prior to surgery. Some people give you a little bit of chocolate to relax you. There's a lot of different little things that you can do that you systematically implement so that when people remark, they remark well about you, they have the wow experience. And ultimately, Ready to Wow is you're forming a relationship, you're forming trust, but you're stimulating a recommendation. You're stimulating a referral, and hopefully that referral, if not is sort of to friends and family, hopefully it ends up online and you start to create really, really cost-effective leads. Because at the end of the day, customer service serves to drive down your cost per lead because you don't have to generate a cold lead. You're generating a constant stream of warm leads for you at a much cheaper rate. So really look at your customer experience and think, how can I wow my patients?
So I like to look at that as an opportunity because you have such a great high level of happiness already. But what you need to do now is you need to convert that into positive ratings, positive reviews, and good referrals. And how you do that is this. First of all, you want to make sure that you're asking early and asking frequently. So some people ask me, I had a question from a customer the other day saying, when should we start collecting reviews? And I said to them, as soon as they come in. They come in, they have their first appointment, they have their experience, assumedly you've treated them very well, and when you've done that, you can ask them to rate their experience. There's no need to wait until they have a life-changing experience like having laser eye surgery and being able to see 20/20 to then ask for that experiential review. You can begin from the outset. And then what you've done now is you've gotten people accustomed to you asking. How I would ask is in person, certainly, but you can also set up mechanisms that everybody who attends an appointment gets a very, very quick questionnaire. How likely would you be to recommend our service to a friend or a family member? 0 to 10. And based on that rating, the ones that give you 9s and 10s, those are the ones you want to then further request a review. And you want to make it easy. You want to send them to your Google property on Google My Business. You want to send them to Facebook pages to leave a review there. After you've had somebody leave a positive review and a good rating on your social media properties, then if you're really bold, you can then later turn that into potentially an opportunity to ask for referrals. And that's something many, many people don't do, but having seen it done effectively, I can attest that it's a great practice and people will be more than happy to share the story of their transformation with all of their friends and family if you only just prompt them to do so and give them the tools that they need to do this effectively. So I encourage you to seek that out. Back when you were in school, you had a relatively easy way to ascertain where you stacked up against your peers and colleagues. However, now that you're in a practice setting, it's a little bit tougher to know where you stack up, not only against your ideal, but also against your peers and your colleagues. And that's why we created the Premium Practice Score. And if you'd like to take that test, if you'd like to see where you stand up against the best in the world, or perhaps the best for yourself, you're able now to take that and then see where you stack up.